Hello, I'm Dr. Venkatesh. I work as the Director and Lead Consultant of Maternal and Child Health at Trustwell Hospitals, Bangalore. Uh, I've been in the profession for the last 3 decades and this is my 32nd year of practice. I would like to share my views on preterm labor and the prevention aspects. Preterm labor, as you all know, is being defined as the labor which gets initiated before 256 days, and it has an enormous implications both to the mother and the child. The perinatal mortality and morbidity that emanates from preterm births is humongous. Just to put it in perspective, it's estimated that in a country like United States, with a population of roughly about 332 million, that is 33.2 crores, preterm labor costs them roughly about $6.2 billion in hospital expenditure year after year. Translating that into our currency, it amounts to about 5,20,800 crores per year. If extrapolating that to the Indian scenario, the cost would be somewhere about 5 times the cost, considering that we are a country of close to 1,300 million population. Having said that, it is high time that we take cognizance and steps to screen the pregnant women who come for antenatal care. The primary prevention involves public education, trying to address certain public and professional policies, avoiding repeated intrauterine instrumentations, trying to advise women against very frequent pregnancies, trying to suggest women about avoiding substance abuse, preferably smoking and other substance abuses, importance of antenatal oral prophylaxis, trying to avoid becoming pregnant at extremes of age, trying to educate women as to importance of screening for asymptomatic bacteriuria, genital tract infections which include trichomonas, bacterial vaginosis, malnutrition, including zinc deficiency, deficiency of omega-3 fatty acids. The secondary prevention or secondary screening would include identifying the fetal anomalies, trying to elicit the history of previous preterm births, trying to avoid multifetal pregnancies, identifying polyhydramnios, identifying intrauterine fetal death, cervical insufficiency, assessment of cervical length at an appropriate time in the first or the early second trimester, fetal fibronectin assay, and identifying uterine anomalies prior to pregnancy, avoiding serious maternal disease, and so on and so forth. So it becomes very imperative to elicit a proper history during the antenatal visit so that these risk factors are identified properly, promptly, and due course of action is taken at an appropriate part of the pregnancy. not to forget the importance of ultrasound, that is, the assessment of cervical length becomes very important. But having said that, we should never forget the importance of clinical examination between say 14 to 16 weeks, because clinically, even if in low resource setting where the ultrasound, professional ultrasound or a fetal medicine expert is not available and assessment of cervical length through ultrasound becomes difficult, clinicians of our generation, we used to solely depend upon our clinical instincts. So clinical examination to elicit a short cervix, which technically in the current context means any cervical length less than 2.5 cm is considered a short at say around 22 to 24 weeks, and due diligence has to be followed. With these few words, I congratulate the initiative taken by Spectra in trying to disseminate the importance of treating and preventing and treating preterm labors. Thank you very much.